All right, hello everyone. In this explainer, we're going to tackle a topic that's pretty specific and honestly quite rare, vulvar endometrioma.
Welcome to MediByte. We're your go-to source for medical info that's clear, concise, and easy to understand. We're really glad you're here with us today.
So let me ask you something to get us started. What if tissue that's supposed to be in one part of your body suddenly started growing somewhere completely different? It sounds a little strange, right? Well, that's the core idea behind the condition we're diving into today.
Here's what we've got on tap. First, we'll look at endometriosis as a whole, the big picture. Then we'll zoom right in on what a vulvar endometrioma actually is. After that, we'll get into the key symptoms, the causes, how doctors figure it out, and of course the treatment and what you can expect next. All right, first things first, we've got to start with the basics. To really get a handle on this rare condition, we first need to talk about the bigger condition it's a part of, and that's endometriosis.
So what is endometriosis really? Well, simply put, it's a chronic disorder where tissue that's supposed to line the inside of the uterus, that's called the endometrium, starts growing outside the uterus, in places it just doesn't belong.
And this is a really big deal. It's not some super rare thing. In fact, around 18% of all women are diagnosed with endometriosis. That's a huge number, which makes it a really important health topic to understand.
Okay, so where does this runaway tissue usually end up? Well, the most common places are the ovaries, the uterine ligaments, and the lining of the pelvis. You can also find it on the fallopian tubes, the bladder, even the intestines. But then you have the really uncommon spots. And that, right there, brings us to our topic today, the vulva.
All right, now that we have that background, let's zero in. It's time to talk specifically about vulvar endometriomas.
So, a vulvar endometrioma is exactly what it sounds like. It's when that endometrial tissue we talked about forms a cyst, but on the vulva, the external genital area. And these aren't just any cysts. They're often filled with blood, which, as you can imagine, can be pretty painful.
And I really want to stress just how rare this is. There's a great quote that says it all. Endometriosis rarely occurs in the vulva. It's just so much more common to find it in other spots, like the ovaries. So this is definitely not a typical case. Okay, so what should you be looking for, and how does this even happen? Let's get into the key symptoms and the potential causes. The number one thing to understand about the symptoms is that they're cyclical. Think about it. This tissue is like the uterine lining, so it actually responds to your monthly hormones. This is why the pain and tenderness, and even pain during sex, tend to ramp up right before and during a period. The cyst itself can even get bigger and take on a kind of bluish color. And, in a worst-case scenario, if the cyst were to rupture, yeah, that can cause some really severe sudden pain. So, why does it happen in this specific spot? Well, the honest answer is, we don't know the exact cause for sure, but there's a really strong clue. It often shows up right where there's been a previous surgery. We're talking about things like an episiotomy during childbirth, or maybe the repair of a tear after delivery. It seems to develop at the site of that old trauma.
I know, hearing about these symptoms can be worrying. But the good news is, the process for getting answers, for getting a diagnosis, is usually pretty straightforward. So let's walk through how it's done.
It all starts with a pelvic exam. A lot of the time, a doctor can actually see or feel the endometrioma right there. They'll be looking for that bluish color and checking to see if it's tender. But to be absolutely sure, the gold standard is a biopsy. That just means they take a tiny tissue sample to get it analyzed. And that biopsy is super important for two reasons. First, it gives you that definite, yes, this is an endometrioma. But second, and this is just as critical, it rules out other things it could be. For example, it makes sure it's not a melanoma, which is a type of skin cancer. So it's all about confirmation and safety. Okay, so you've got the diagnosis. What's next? The great news here is that the treatment is very effective. Let's talk about the solution.
The main treatment, plain and simple, is to surgically remove the cyst. Now, I know the word surgical removal can sound a little scary, but in this case, it's usually a really simple procedure. So simple, it can often be done right in the doctor's office. They just use a local anesthetic to numb the area so you don't feel anything, and of course, the tissue they remove gets sent off to the lab just to double-check everything.
Okay, so let's do a quick recap of the most important points. 1. Vulvar endometriosis are a rare type of endometriosis. 2. That cyclical pain tied to your period, that's the hallmark symptom. 3. Diagnosis is straightforward. It's usually just a pelvic exam and a biopsy. And 4. The treatment is simple and effective, surgical removal.
And that brings me to one last thought to leave you with. We've talked about how these specific symptoms are the key to a diagnosis. It really makes you think, doesn't it? How much faster could people get diagnosed and get the help they need if we all felt more comfortable having open, honest conversations about pelvic health? It could really change things for the better.
Hey, if this explainer helped you understand things a little better, do us a huge favor and hit that like button. Share it with someone who might need it and subscribe to the MediByte channel. Our whole goal is to keep bringing you clear health info like this. Thanks so much for watching.